Frozen shoulder is a common issue that patients who are experiencing shoulder pain deal with on a frequent basis. Hi, my name is Eric Hammer, registered physiotherapist and owner of Home Comfort Physiotherapy. And today I want to talk a little bit about the condition of frozen shoulder and some of the treatment options that patients might look into if they're experiencing frozen shoulder. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially what frozen shoulder is, it's a condition also referred to as adhesive capsulitis. And essentially what it means is it's an inflammation and a tightening of the anterior capsule of the shoulder. And it takes part in three different phases. So the first phase will be this pain phase, where essentially the area becomes extremely sensitive and painful. The shoulder becomes very sensitive. And through that, what ends up happening is we get what's called a freezing phase. So during this time, essentially what happens is the capsule begins to tighten and tighten, and it becomes frozen and freezing, and we lose more and more range of motion. And what you'll find with the patient is the mobility is lost both actively, right, if the patient is doing the movement, as well as passively. And you'll see a distinct pattern of loss of external rotation, this movement here, loss of flexion and abduction, and loss of hand behind back. They'll really struggle with these different movements. And so again, it will progress from this pain phase to this freezing phase to then eventually a thawing phase in which the mobility starts to return. Now, what's difficult about this condition is number one, research we don't really know specifically why some people get this condition. Sometimes there can be a trauma of some type or something that's taking place that might lead to a frozen shoulder. But in other cases, it can essentially just come out of the blue, where there's not necessarily anything that the patient can pin to that has led to these phases, right, of pain, of again, this frozen phase of losing mobility, and again, going through the different phases of frozen shoulder. So it doesn't necessarily have to have a specific, something that's taken place, a trauma of some type that leads to it, although it can. And then the other thing that can be very difficult with this is there isn't necessarily a specific time frame that a patient will go through in terms of getting to this thawing phase. It can take quite some time. For some individuals, it might take years, right, for this to return. And so typically, in terms of interventions for this, some of the research, what's suggested is once it's been determined, right, that somebody is presenting with a frozen shoulder, for some individuals, a cortisone shot is recommended. And the reason for that is the research shows that if you're essentially during this sort of freezing phase, if you're able to get a shot during this phase, it can tend to decrease it and sometimes reverse it if it's caught at that phase. The other thing that they've mentioned is that if it is frozen, typically that sort of intervention doesn't necessarily work as well. And then it's more about just doing a conservative type of treatment, in which, again, that could look like doing exercises to help try to maintain and, if possible, regain some range. Now, when it comes to regaining or maintaining range, a key thing with frozen shoulder is making sure that we're not pushing into pain. So one of the things that is mentioned in the literature is this idea about moderate mobility versus really trying to push to end range. And typically the type of exercises for this are what's referred to as active assisted range of motion, in which the patient will perhaps use their other side, right, to do movements to help regain some of the mobility back in through the shoulder. Then the last phase of this is once the shoulder has gone through this sort of thawing phase, or once there's been a change in terms of mobility, to then strengthen the rotator cuff muscle. This again can be quite a long process. And again, unfortunately, there isn't necessarily specific time frames of how long somebody will go through these three phases of pain, freezing, and thawing. If you have any questions or concerns, feel free to leave a comment below. And if you're an individual who might be struggling with some sort of shoulder mobility and pain issues, and you're looking to get some guidance out of the comfort of your own home, feel free to reach out. I'll leave my contact information below. And please check with a physiotherapist to make sure that this or any other information is appropriate for you. Thanks again for watching and have a great day. Take care.